Everything that happened in medicine today in 60 seconds or less. Supreme Court upheld Tennessee law when it comes to transgender care for youth. This means that things like gender transitioning surgery is no longer going to be available in states like Tennessee for minors, and it means that states that try to sue other states that currently have that are going to have a harder time due to this recent ruling. However, states that currently have it in place are not going to have any issues when it comes to the Supreme Court ruling. Study links cannabis to a higher risk of heart attack. So they found that cannabis use was associated with the higher risk of heart attack, specifically between studies of 2016 and 2023, 29% higher risk of heart attack, and a 20% higher risk of stroke, as well as twice as more likely to die from cardiovascular-related deaths. New study links addictive screen time to suicidal behavior. This is different than looking at total screen time, where you just count the amount of hours. Instead, we're looking at how does your brain actually react to it based off kind of formal questionnaires like, do you have anxiety when you don't use your phone? This was concerning because those who had addictive screen time behaviors had double the risk ratios compared to those who did not have an addictive time with their phones. Lastly, University of Arizona is making both of its medical schools, yes, there's two, a 3-year program instead of 4. This is primarily to help combat the primary care and internal medicine shortages that are in the area as a way to help individuals get into the practice sooner, and they're going to be cutting some of the extracurricular parts as well as electives when it comes to it, but their goal is to make it so that physicians are able to graduate sooner. If you want to support my page for everything, you can find links for that in the bio. Or if you just want all the links to what we talked about today in a more in-depth analysis, you can find that in my Substack, which is also in my bio. But stay tuned for tomorrow. We'll go over tomorrow's news as well. See you then.